One of the most common reasons that people start to microdose psychedelics is to wean off their ADHD medications, things like Adderall, ritalin, and vyvanse. They're quite addictive, they're highly stimulating, and people are looking to microdosing for something that's much more balanced. And so in today's video, we're going to talk about what are some of the differences between microdosing psychedelics and ADHD medications like Adderall, ritalin, and vyvanse. But before we get into today's video, make sure you subscribe to our YouTube channel so you can stay up to date on all of the latest information details. So first of all, LSD and psilocybin are two different substances when we're looking to microdose. LSD is a semi-synthetic. It lasts for about 12 hours and is more dopaminergic, meaning there's more dopamine that's created when we're microdosing with LSD. And the reason I mention that is because the felt experience of microdosing LSD is most similar to the traditional ADHD medications like Adderall, ritalin, and vyvanse. There's a few key differences, though, between microdosing LSD and these ADHD medications. First and foremost, one of the benefits or upsides of these ADHD medication is they do have years and years and years of clinical research and use in humans to show that they are reasonably healthy. We are just starting to learn about microdosing LSD. The science is just starting to come out. We don't have really long-term longitudinal data about microdosing LSD in particular. So that's just one contextual thing that will be helpful for you if you're considering microdosing LSD compared to the traditional ADHD medications. Now, with that being said, ritalin, Adderall, and vyvanse, a lot of these ADHD medications are highly addictive. And so once you start on these ADHD medications, it's very, very difficult to get off of them. And that weaning process can often cause headaches and fatigue, mood issues, and it's probably the biggest reason that people stay on the ADHD medications is because they are so addictive. LSD and all psychedelics are actually anti-addictive. So you can create some psychological dependency, but there's no physiological dependency with microdosing LSD. I've been microdosing LSD on and off for the last 7 years. Whenever I feel good with it, I put it down. There's no withdrawals, there's no weird symptoms, there's no crashing and jittering and all that. I just sort of go back to a normal everyday life. The other main difference between the ADHD medications and microdosing LSD is LSD has a little bit more of a playful, open, loving quality to it. A lot of the ADHD medications get very intense. They're very stimulating, and there's this sort of narrow tunnel vision that comes with them. What's great about microdosing LSD is that you get the focus, the attention, and the motivation, but there's a nice sort of rounded element to it. LSD feels more playful and more creative. So yeah, you can have that sense of focus, but it doesn't have to necessarily be so constricting. There's a lightness that comes when we're microdosing with LSD that we don't necessarily feel with these stimulants for ADHD. Now, a couple more things about that overlap between LSD and the ADHD medications. LSD is just starting to go through clinical trials to be utilized as a medication for ADHD. So we would expect within maybe 2 to 3 to 4 years for microdoses of LSD to become clinically available, legally and clinically available to treat ADHD. Until that point in time, it's very important that if you're considering weaning off those ADHD medications and instead microdosing with something like LSD, that you do so with the support of a trained medical professional. And I know what you might be thinking, that your psychiatrist that you work with really has no idea about psychedelics. First and foremost, just ask them about it, talk to them about it. If they are not educated or they really don't know what's going on, then go to Third Wave's directory. In Third Wave's directory, we have psychiatrists listed who are familiar with psychedelic substances. And it matters a lot that you are under the tutelage or guidance of a psychiatrist if you do want to wean off those ADHD medications and start to microdose with LSD. And again, none of this is health advice. It is not medical advice. But we want to make sure that you do so as safely and effectively as possible. One more important point, LSD is not contraindicated with any of these medications, Adderall, ritalin, and vyvanse. So I've heard a lot of anecdotes from people who, as part of that weaning off process, they actually microdose at the same time to help minimize and mitigate some of those really nasty withdrawal side effects that might happen when you're trying to wean off some of these ADHD medications. Again, do this under the tutelage of a licensed psychiatrist, but do know that LSD is not contraindicated with any of these ADHD medications. Final point, in the video today, we talked a lot about LSD, microdosing, and how that could be used potentially as a replacement for these ADHD medications. A lot of people have also found success with microdosing psilocybin. So psilocybin is a natural organic compound and substance, unlike LSD, which is a semi-synthetic. Psilocybin can also be combined with other herbs, ashwagandha, rhodiola, lion's mane, and that combination and that synergy can often help with, again, some of the withdrawal symptoms that you might have from weaning off ADHD medications. And psilocybin is also much more serotonergic. There's a lot more serotonin that's produced with psilocybin compared to LSD, so it feels more embodied, it feels more calm, it feels more centered. And that might be a really nice balance compared to the ADHD medications, which are highly, highly stimulating. Even something like LSD, when we're microdosing, has a very, very stimulating effect. And so working with a microdose of psilocybin might help to balance all of that out, allowing for a weaning off of these medications, and also allowing for an inner confidence for you in knowing that you're not going to be addicted to this thing anymore, and that if for whatever reason you ever want to stop microdosing with LSD or psilocybin, it's as simple and easy as just stopping. There's no withdrawals, there's no nasty side effects like a lot of these psychiatric medications. So that gives you an overview of microdosing LSD, a little bit about microdosing psilocybin compared to these ADHD medications. And again, I can't emphasize enough, if you do intend to wean off or get off of those medications and microdose with psychedelic substances, please do so under the guidance of a trained medical professional. Thank you so much for watching. If you want to stay up to date on the third wave of psychedelics, subscribe to this channel and visit thethirdwave.co, where you'll find plenty of free resources on the intentional and responsible use of psychedelic medicine.